The most dangerous mistake with blood pressure medication is not always taking the wrong pill. Sometimes it is taking the right pill at the wrong time for your body. That may sound like a small detail, but blood pressure is not flat throughout the day. It rises, falls, responds to stress, changes with sleep, reacts to meals, and shifts when you stand up, walk, sit, or lie down. So when medication enters the bloodstream, it does not meet the same body every hour. It meets a body that is constantly changing. I am Dr. Warren Hung, a medical doctor, and this is one of those topics that needs to be explained carefully, because the wrong message can scare people into making dangerous choices. So please do not stop or change your medication on your own. If you take blood pressure medicine, this is information to discuss with your doctor or pharmacist, not a reason to experiment by yourself. And if you appreciate clear health explanations that protect you without confusing you, subscribe to the channel so you can keep learning how your body works in plain language. The reason timing matters is simple. Blood pressure medication is meant to lower pressure inside the blood vessels. That pressure is what your heart pushes against every time it pumps. When the pressure stays too high for years, it can damage the arteries, heart, brain, kidneys, and eyes. But pressure can also fall too low. That is the part many people are not warned about clearly enough. If blood pressure drops too low, especially in an older adult, the brain may not get enough blood for a moment. That can cause dizziness, weakness, blurry vision, confusion, or a fall. And a fall after 60 or 70 is not a small event. A broken hip, a head injury, or a loss of independence can begin with just a few seconds of lightheadedness. So the goal is not simply to push blood pressure down as much as possible. The goal is control. Safe control. Steady control. Control that protects the heart and brain without leaving the person weak, dizzy, or vulnerable. This is why the timing question is more personal than many people realize. For one patient, taking medication in the morning may work well because their blood pressure rises sharply after waking. For another patient, taking the same medication late in the evening may cause pressure to drop too low overnight. For someone else, nighttime dosing may be useful, but only because their doctor has reviewed their pattern, their readings, their kidney function, their other medications, and their symptoms. The pill is only one part of the story. The body's rhythm is the other part. Blood pressure follows a daily rhythm. During sleep, it often dips. This dip can be healthy because the heart and blood vessels get a kind of rest. Then, in the early morning, the body releases hormones that help you wake up. The nervous system becomes more active. Blood vessels tighten. Heart rate may rise. Blood pressure often climbs. That morning climb is one reason strokes and heart attacks are often linked to the early hours of the day. The body is shifting from rest mode into active mode, and that shift can put stress on arteries that are already stiff, narrowed, or damaged. But that does not mean everyone should automatically take blood pressure medication at night. This is where people get misled. Some hear that morning blood pressure is dangerous, so they assume nighttime medication is always better. Others hear that nighttime medication can cause dizziness, so they assume morning is always safer. Neither answer is safe for everyone. The dangerous time is the time that does not match your body's pattern. That is why home blood pressure readings can be so helpful. A single reading in a doctor's office does not show the full rhythm. It is like looking at one photograph and trying to understand an entire movie. A morning reading, an evening reading, symptoms when standing, and patterns over several days. During the night, your body is supposed to slow down. The heart does not need to pump as forcefully as it does during the day. The muscles are not demanding as much blood. Stress hormones are usually lower. Breathing, heart rate, and blood vessel tension often settle into a quieter pattern. For many people, blood pressure drops during sleep. Doctors call this a nighttime dip. In plain English, it means the pressure in the arteries eases while the body rests. That dip can be normal and healthy. But if the dip becomes too deep, especially in someone taking medication, the brain may not get steady blood flow during vulnerable moments. This does not always cause a dramatic warning. It may show up as waking up weak, feeling foggy in the morning, stumbling on the way to the bathroom, or needing to sit on the edge of the bed before standing. That matters because nighttime is when people are least prepared to protect themselves. The room is dark, the body is sleepy, reflexes are slower. Many older adults wake up to urinate, stand quickly, and walk before their circulation has adjusted. If blood pressure is already low from medication, dehydration, alcohol, or a water pill taken too late, that short walk can become dangerous. This is one of the reasons doctors ask about dizziness, falls, and bathroom trips at night. They are not small details. They can be clues that pressure is dropping at the wrong time. There is another pattern that can happen on the opposite side of the night. In the early morning, the body begins preparing you to wake. Hormones rise, blood vessels tighten, the nervous system becomes more alert. The heart starts working harder, blood pressure can climb quickly. This early morning rise is often called the morning surge. Think of it like a car engine turning on after hours of rest. If the engine is healthy and the road is smooth, the start may be fine. But if the arteries are stiff, narrowed, inflamed, or already under stress, that surge can create strain. This is why some serious events are more common in the morning. The body is moving from rest into action, and that shift can stress the heart and blood vessels. But the answer is not simply take every blood pressure pill at night. That is too simple, and for some people, it can be unsafe. The same medication timing can create very different results in different bodies. One person may need better protection during the early morning rise. Another person may already drop too low overnight. Another person may have kidney disease, diabetes, balance problems, or other medications that change how safely their pressure responds. This is why guessing is risky. Some blood pressure medications last a full day. Some peak after a few hours. Some are stronger at certain points after you take them. Some cause more urination. Some affect heart rate. Some relax blood vessels. Some remove fluid. Some combinations can make pressure fall more than expected when you stand. So the question is not only morning or night. The better question is, when is this medication strongest, and what is my body doing at that time? That is where symptoms become valuable. If you wake up dizzy, that is information. If you feel unsteady during nighttime bathroom trips, that is information. If your morning readings are much higher than your evening readings, that is information. If you feel weak after taking your pills, that is information. If you feel lightheaded when standing from a chair, that is information. These signs do not automatically mean your medicine is wrong. They mean your pattern deserves attention. One of the most overlooked problems is orthostatic hypotension. That means blood pressure drops when you stand up. The word sounds technical, but the experience is simple. You go from sitting or lying down to standing, and suddenly the brain gets less blood for a few seconds. You may feel dizzy, faint, shaky, or as if the room is moving. This can happen more often with age, because blood vessels may not tighten as quickly. The nerves that help regulate pressure may respond more slowly. Medications may stay in the body longer. Dehydration may happen more easily, and after years of high blood pressure, the body may not handle sudden pressure changes as smoothly. That is why an older adult can have good blood pressure while sitting. One of the most common mistakes people make with blood pressure medication is trying to fix a bad reading without understanding why the reading happened in the first place. A person checks their blood pressure, sees a high number, becomes anxious, and decides to take an extra pill. A few hours later, the pressure drops too far. They stand up, feel weak, and almost fall. Sometimes the danger did not begin with the medication itself. It began with fear and guesswork. This is why doctors want to see patterns, not isolated moments. Blood pressure changes throughout the day. Stress, pain, caffeine, poor sleep, dehydration, missed meals, illness, and even anxiety during the measurement can affect the number. One high reading does not always mean you should immediately change how much medication you take. Doubling doses without medical guidance is especially risky in older adults. The body processes medication differently with age. Kidney function may slow down. Fluid balance changes more easily. Some medications stay active longer than expected. And the dangerous part is that the pressure may not drop immediately. Some people take an extra dose because they feel fine, not realizing the medication may peak hours later, during sleep, or while they are walking around the next morning. This is also why skipped doses can become a problem. Some people forget their medication, remember later, then decide to take 2 doses close together. Others skip a dose because they feel dizzy one day, then restart without understanding what caused the dizziness. The body does not respond well to those sudden swings. Think about the arteries, like plumbing under pressure. The goal is not wild ups and downs. The goal is steadiness. Repeated swings between very high pressure and overly low pressure can place stress on blood vessels, especially in the brain and heart. Another mistake happens when people take blood pressure medication too late in the evening without realizing how it affects their nighttime circulation. This is especially important with medications that increase urination. Taking them late may cause repeated bathroom trips overnight. Each trip means getting out of bed, standing, walking, and adjusting balance while sleepy. Now combine that with low blood pressure, darkness, stiff joints, or poor balance. That combination can become dangerous very quickly. This is one reason many doctors prefer certain water pills earlier in the day, unless there is a specific reason to do otherwise. Again, this depends on the individual person and medication, but the principle matters. Medication timing should match the body's daily pattern, not convenience alone. Alcohol creates another hidden problem. Some viewers may notice they feel more dizzy after having wine, beer, or liquor while taking blood pressure medication. That is not their imagination. Alcohol can relax blood vessels and increase the blood pressure lowering effect. It can also worsen dehydration, especially overnight. For someone already taking medication before bed, alcohol may increase the risk of nighttime dizziness or early morning weakness. The same issue can happen with dehydration during hot weather. This catches many people by surprise. They continue taking the same dose, but suddenly they are sweating more, drinking less water, eating less, or spending more time outside. Blood volume drops, pressure may fall more easily. Then the person stands up and feels faint. This becomes even more important after stomach illness, diarrhea, vomiting, or poor appetite. A medication routine that worked safely last month may suddenly become too strong under different conditions. That is why symptoms matter as much as numbers. If someone says, "My blood pressure is normal, but I feel terrible," that deserves attention. Weakness, dizziness, blurry vision, confusion, heavy fatigue, or feeling faint after standing can sometimes mean the body is struggling with pressure changes. One pattern doctors often hear sounds like this: "I feel okay sitting down, but when I stand up, I feel strange for a few seconds." That short moment matters. The brain needs constant blood flow. Even a brief drop can affect balance and awareness. In older adults, those few seconds can lead to falls that change a person's life permanently. Another overlooked mistake is changing medication timing randomly from day to day. Taking a pill at 7 a.m. one day, midnight the next day, then mid-afternoon after that can create uneven coverage. The safest way to think about blood pressure medication timing is not, should everyone take it in the morning, or should everyone take it at night? The better question is, what is my blood pressure doing across the day, and when does my medication need to work the most? That small shift changes everything. Some people need stronger control during the early morning rise. Some need to avoid pressure dropping too low overnight. Some need a medication schedule that protects the heart without increasing dizziness. Some need timing adjusted because of kidney disease, diabetes, heart rhythm problems, prostate medication, sleep medication, or a history of falls. This is why the safest plan is personal. A good first step is to track blood pressure in a way your doctor can actually use. Do not just write one number on a random day. Try to record the time, whether it was before or after medication, whether you were sitting or standing, and how you felt. For example, morning before pills, evening before bed, and any moment when dizziness happens. That gives a pattern. And patterns are much more useful than panic readings. If you wake up lightheaded, write that down. If you feel dizzy after standing, write that down. If your pressure is high every morning but lower later, write that down. If your pressure drops after taking your medication, write that down. If you have nighttime bathroom trips and feel unsteady, write that down too. Those details help your doctor decide whether the issue is medication timing, medication type, dose strength, dehydration, another drug interaction, or something else entirely. The next step is to know what kind of medication you are taking. You do not need to memorize medical textbooks, but you should understand the basic purpose. Some medications relax blood vessels, some slow the heart, some help the body remove extra fluid, some protect the kidneys, some last longer than others. Some may be better taken at a certain time because of side effects. This is where your pharmacist can be very helpful. Ask a simple question: when is the safest and most effective time for me to take this based on my other medications? That one question can prevent a lot of confusion. And please do not assume that because a neighbor takes their pill at night, you should too. Do not assume that because someone online says morning is better, that applies to you. Blood pressure treatment depends on the person, the medication, the dose, the symptoms, and the reason it was prescribed. Another safety habit is to avoid doubling doses unless your doctor has specifically told you what to do when you miss one. This matters. Many medication mistakes happen after a missed dose. Someone forgets the morning pill, remembers at night, then takes it close to the next dose. That can cause too much medication to overlap. Instead, ask your doctor or pharmacist in advance: if I miss a dose, what should I do? Write the answer down. Do not wait until you are anxious and staring at a high reading. You should also be careful during illness, hot weather, poor appetite, vomiting, diarrhea, or dehydration. These are times when blood pressure can behave differently. The same medication routine may feel stronger because your body has less fluid or less stability. That does not mean you should stop medication on your own. It means you should know when to call for guidance. Call your healthcare provider promptly if you are having repeated dizziness, fainting, falls, confusion, very low readings, or symptoms that feel new after a medication change. And seek urgent help if you have chest pain, severe shortness of breath, weakness on one side of the body, trouble speaking, sudden severe headache, fainting, or signs of stroke or heart attack. Those are not moments to watch and wait at home. For everyday safety, small routines help. Stand up slowly from bed or a chair. Sit on the edge of the bed for a moment before walking at night. Keep a light near the path to the bathroom. Stay hydrated unless your doctor has restricted fluids. Be cautious with alcohol. Use a pill organizer if your schedule is complicated. Keep an updated medication list. These habits may sound simple, but they protect the moments when blood pressure changes quickly. The real danger is not that blood pressure medication exists. These medicines protect millions of people from stroke, heart failure, kidney damage, and heart attacks. The danger is using them without understanding timing, symptoms, and the body's rhythm. The goal is steady protection,